Covered entities may disclose limited information to a patient's family, friends, and persons involved in their care. Providers must exercise professional judgment in deciding what information should be disclosed. The rule for informal disclosures is Section 164.510 of the Privacy Rule. This regulation has two kinds of disclosure standards. The first standard relates to facility directories. Subsection B relates to patient care and notifications. The facility directory contains the patient's name, location, condition, and religious affiliation. Members of the clergy may review all of the directory information. Friends and family may only learn the location and general condition of the patient. Patients must be given an opportunity to restrict or prohibit disclosures in the directory. If the patient arrives unconscious, the directory may only disclose information if it's in the patient's best interest. A provider can make informal disclosures relevant to health care or payments. Providers can notify significant others about the patient's condition. When a patient has capacity to make decisions, the provider must try to get the patient's agreement or give the patient an opportunity to object to permissive disclosures. If a patient doesn't say anything, the provider may reasonably infer the patient has no objection. A provider must exercise professional judgment in determining the scope of permission. PHI can be disclosed to Red Cross and other agencies that assist with disaster relief. HITECH added a new section regarding decedents. Providers may disclose circumstances of death to family members of the decedent. The HITECH Act also provides a new definition of family member. Now we'll examine how permissive disclosure works in the town of Single Peak. Fred, a dental patient, just arrived in the emergency room. He choked on a metal fragment that suddenly went down his throat. The dentist's office called 911. Sisters Edna and Agnes heard sirens.
Wonder what happened at the dentist office. Let's go to the hospital and find out.
Fred had a CT scan soon after he arrived. He was still in radiology when his wife Wilma arrived. He was nowhere in sight. Fred's name wasn't in the directory yet. A nurse helped Wilma locate her husband.
Hello, you must be Fred's wife. I'm the emergency room doctor taking care of him. I can answer questions relevant to your husband's care.
A short time later, Agnes and Edith arrived at the hospital. They walked over to the reception desk.
May I help you?
We're looking for the person who came by in the ambulance.
Something went wrong at the dentist's office. I'm sorry, I can't disclose information if you don't know the patient's name.
See, I told you HIPAA would be a problem.
Even though Fred's condition was good, Agnes and Edith left the hospital without knowing that information. Downstairs, Pastor Paul walked into the hospital. He reviewed the entire directory and saw Fred's religious affiliation and decided to go upstairs to visit.
So nice of you to stop by. Please stay a while. Dr. Pruitt is almost finished with my discharge instructions. I don't object to your listening.
All right, Fred. What pharmacy do you use? Perhaps Wilma could get your prescriptions on the way home.
And that's just what Wilma did.
Hi, Mrs. Flintstone. Are you picking up prescriptions for your husband?
Yes, are they ready?
Yes, here they are. Can I answer any questions related to these medications?
No thanks, I think we're good.
Wilma went home. The next day, Fred and Wilma were catching up with news.
You know, I'm worried about our daughter-in-law stationed in Germany. We haven't heard anything about the bicycle accident last week. Let's find out how she's doing. Do you suppose the Red Cross would give us an update on her medical condition?
Let's try calling the exchange in Germany. Can you give me a report on my daughter at Heidelberg Hospital?
Is your daughter having a baby?
No, she had a bicycle accident.
I'm sorry, our service is limited to serious illness, death, and childbirth.
I guess we'll just have to wait till she calls us. You know, I think we should call the nursing home to see how Barney is doing.
Barney's phone rang and rang, but there was no answer.
I'm really worried. Barney was asleep the last time I visited.
I'll go over there myself to check on him. Hi there. Are you looking for Barney?
Yes, where is he?
Are you a member of Barney's family?
No, I'm just his next door neighbor, but we're good friends.
Have you been involved in Barney's care?
Not exactly. I've been taking care of his yard, though.
Well, I am very sorry to tell you that Barney passed away yesterday.
Oh no, what happened?
I can only give you his general condition. You'll have to ask the family for more details.
We covered some examples of the informal disclosure rule. HITECH recently made it easier for family members to find out how their loved one died. Thanks for watching. We have more tutorials coming. Thank you in advance for comments and suggestions.